helps increase that healing capacity and allows for normal motion to be restored. Hey Apple Valley, Dr. Brian here from Able Chiropractic and Wellness Center. Today I'm here with Tricia. Tricia is a patient of mine that came in with knee pain. And it wasn't the kind of knee pain like you can rub it off. It was severe knee pain that was stabbing, hurting. It was stopping her from climbing stairs and moving around the house. And Tricia is someone who loves to be outside, plays a musical instrument and is in bands that goes and plays out in the parks and stuff like that. And it was stopping her from hiking, from up at Grand Moran. I know you said you couldn't get up and down the stairs in her camper. What a bummer. And so we're gonna walk you through the exact knee protocol that we use to restore her knee, getting her back to doing the things that she loved, taking her from not being able to walk upstairs to being able to confidently walk up and down the stairs in the trailer or around the house, and doing the things that you love, and even playing musical instruments out in the parks. Based off the exam that we did for Tricia, in her digital x-rays, we found that her knee had some degeneration, but nothing that we can't work with. She had stress on the tendons and ligaments from the medial and the lateral side. Her patella was out of place, so it explained exactly why she was having the knee pain. We also found in her pelvis that her pelvis was misaligned. That was causing her gait to move differently, or what we would call a giddy up as she walked, putting more pressure into one knee. And it was crucial in making sure that we adjusted both the knees and the pelvis to get the long-lasting results so that she could get back to doing the things that she loved and not have this come back. So now we're going to do an exam. Come on over here. In the palpatory evaluation, as we were palpating, we found that exactly what we found on the x-rays, the medial and the lateral side had a lot of pain and discomfort. When we did the range of motion, she could only bend to about 90 degrees at that time. So it confirmed the findings and helped us understand what we need to do to correct this. After we've done the exam and we find exactly what we're going to work on, we have 3 phases that we go through. The first phase is TRT. We always start with TRT, tissue regenerative therapies. First one is laser. This is a 60-watt class 4 laser. It's not a cold laser, it's a warm laser. And these warm lasers will penetrate deep into the tissues. This specifically can penetrate 6 inches. When we're working on a knee, we want to be able to get as deep into all areas of that knee as possible, into the meniscus, into the osseous or the bone degeneration and parts that are irritated. So, Tricia, I'm going to put this on you.
Okay.
Most patients are going to report it feels like a gentle ray of sunshine. It's soothing, it's relaxing, people enjoy it, and it's speeding up the cells to heal by creating ATP. ATP is the energy of the cell so that it can heal quicker. So right after the laser, we go to PEMF. This is the second phase of phase 1, where we use pulse electromagnetic force therapy. This is another therapy that stimulates a healing response. What it does is it stimulates the cell to have more power. And it's kind of like your phone. If your phone loses power, it has all the great technology in it, but it does nothing, right? Same thing with the body. Sometimes the body has the ability to heal, but it doesn't have the energy. This is stimulating the energy in those tissues so that they can reduce the inflammation, heal the damaged tissue, and help people get out of pain quickly. The third part of phase 1, the TRT, is Shockwave. Shockwave for Tricia's knee was a big part of helping her knee recover. What Shockwave does is it will help us pinpoint the areas that are damaged the most so we can focus on those areas. It also has a couple properties. One is it creates nociceptive metabolites. Nociceptive metabolites are what go in and erase the pain. So a lot of people notice quick relief after their shockwave therapy. It also stimulates growth factors, and growth factors are what helps it heal, but they're the precursors to stem cells. And so there's generation, in the research shows there's generation of stem cells in those tissues to regenerate those tissues. Okay, phase 2 is chiropractic adjustments. Specific for her knee, we want to stimulate normal joint function and movement. We also want to stimulate the proprioceptors and mechanoreceptors, which tell the brain how this is moving. So it helps increase that healing capacity and allows for normal motion to be restored. For Trisha, also, we found that her pelvis was misaligned, and so we also want to adjust the pelvis. For Trisha, we also adjusted the pelvis and the lumbar. We used the ArthroStim to stimulate the SI joints and the lumbar spine, and then make sure that we align up the pelvis with a drop. Gentle, easy, and very effective, helping people get out of pain and restore the motion so that the knee can function properly. Phase 3 is the knee on track. The knee on track is a decompression therapy for the knee that opens up the knee joint, allowing synovial fluid to come in and regenerate the meniscus and the tissues there. Most people, after they're done with it, they feel a little bit lighter. The cushion in their knee is a little healthier, and it's part of the process of regenerating this. What it looks like and sounds like is this. Again, it's just a gentle distraction that people really enjoy, and it feels great. It takes about 4 minutes to do. So I've gone over a lot in this Able Chiropractic knee restoration protocol, the superhuman protocol that includes the laser, the PEMF, the shockwave, then the knee on track. What I want you to know is that what this does is it energizes those tissues. Think about this as far as your body being a vehicle. In a car, like a high-end car, whatever your dream car is, it needs gas. That's what the laser does. It gives it more energy. It needs a battery. Your car doesn't go anywhere without a battery. That's what the PEMF does. And then it needs all the great mechanics in it to move, right? The transmission, the axle, the engine, all that stuff. That's what the shockwave does. It brings healing factors. All 3 of these work in a synergy to stimulate a healing response. Then we put you on the knee on track that opens up that joint like an accordion, and it pumps the fluid into those tissues so that your knee can get back to doing what your knee is supposed to do, function. So you can hike, you can bike, you can walk up and down stairs. So if you're ready to do these things, if you're ready to get out of pain, click the link below. Let's do a consultation. Let's do an exam. And if you come in from this ad, you're going to get the whole rejuvenation therapy in this, and we're doing it for $100 off. So click the link and we'll see you in the office.